Here we have a all right, I think we are live. That just kind of jumped on when I do it through this software, but wait for people to show. Okay. There we go. Some people are showing up. Becky H, hello. Now some people are showing. So the lighting is a little weird here. Paul, hello, hello, Paul. Now people are showing up. Trish, hello. Deb Lepley, hello, hello. And Ali Teensy1, Melissa Leach, Joanne Topping, everybody's showing up. Clara Griner. All right, I'm downstairs today because Mrs. Popsit is taking a nap because we have a lot of kids and our dog has stomach issues and woke us up at 2 a.m. and at 4:30 last night, so I'm a little tired. However, we got DC, Sherrod, hello from North Carolina. Awesome, everybody's showing up. Thanks for popping by, guys. I hope you're having a great Sunday. I'm a little tired. Yeah, our dog's having stomach issues, so he'll wake us up to go out. And man, it's tough. We had so much fun. We just watched the sunset we went to the jacuzzi. We live in a little place. It's a little lake, and it was a great night. It's cool because we have a date night. We don't even have to leave the house. We just kind of take the boat out and relax. It was very fun. We needed rest, basically. So good stuff. But awesome. So man, we have 80 people. This Mr. Popsit live channel is growing. We started out with 15 or 20 and now we're getting up close to 100 on these lives. I love it. On Sundays it seems to be a little better too. And I'm going to have a video exclusive that's coming that nobody's seen yet of the one chest, one cup, like a year and a half out now. So that's going to be nice. Also, I wanted to let everyone know that if you ordered a pop socket or a sticker with your t-shirts, they're going to come in 2 separate orders. So with the merch. So just wanted to let you guys know that, it's always in the first month, a little bit of, you got to oil out the issues with shipping and all that, but we're getting it. So it should be good. So thanks again for support. Also, there was quite a few orders that came through on that last live. So at MrPopsit.com, we've got merch that is live. So I appreciate the support, everyone. So let's talk about this inflammatory acne. I'm gonna make myself smaller here and go right over here in the corner. Get those glasses. So I'm going to play this video and I'm going to stop it in a couple areas and we'll talk and then about what we're doing, what she has going on, and why we're doing what we're doing. Perfect example of severe inflammatory acne on the face. A lot of times hormonal in females, and this is a pretty good size one, over 2 centimeters. And this is going to be just a quick example of how we address these, how we can dry them up a lot quicker. We are going to do an oral antibiotic, but we're going to do a little lido right where we're going to poke it with an 11 blade, drain out what's in there, and then we're going to do a little Kenalog 5, which is a low strength steroid into the pocket to help dry it up even quicker. And she has 2 on the chin here, you can see. So one thing I wanted to say, you want to, if you're a provider and you're injecting Kenalog in the face, you want to be very careful, especially on the upper face and the forehead and the temple region, because it'll dissolve or eat up collagen and cause an indentation, and you can cause steroid atrophy. And that can happen even with low strength sometimes when you're overbone. The cheeks are a little bit more forgiving. However, you want to be very careful injecting acne. A lot of people do inject acne. I inject acne. It's got to be a pretty ripe lesion. If it's on its way out, I won't. Oh, we just broke 100 people. That's great. Nice. Thanks, guys. So when you're injecting that, I'll usually do a little poke and drainage and then put that Kenalog in there to help kind of shrink down and dry that up. So that's very very helpful to make a large acne nodule go away a lot quicker, usually within just 2 or 3 days. So it goes away pretty quick. But we'll see here. Now she has hidradenitis suppurativa, which is a chronic inflammatory condition that's in the same family as several acne conglobata, which is the large acne nodules that you'll see on people's backs. Some of the patients that we've seen with the dissecting cellulitis of the scalp, where it's separating, you get these big pockets of purulent discharge. You'll see that as well. And these things are in the same family. And a lot of times these patients will have chronic inflammation that kind of comes and goes and comes and goes. Oh my gosh, Sorsha Ireland, thank you so much for the super chat. I appreciate it. Thanks for the support. I really appreciate that. So every bit helps, I say. So when you're getting these big inflammatory nodules, a lot of times lowering the inflammation and sugar and carbohydrates diet does play a role in weight gain as well. So when people start eating less carbs or eating less sugar, they don't they don't gain as much weight usually. When they lose weight, that also helps. So that's just with inflammation overall in the body, including acne and some of these inflammatory acneiform conditions. So let's see here. I'm going to push play so you can see how big these were. We'll come in here, right there, and then one down here. Get my light. That's what I was like. I was missing something. Ouch. You can see here we have a good nodule right here, and then we have another one right here on the chin. So thank you, Sorsha. I'm going to do just a tiny bleb of lidocaine here. Just a little shot right at the surface. Sorry. Going to blanch it a little bit. Very good. Another little tiny bit here. Mm-hmm. You feel that because the pressure just increased. We're going to release that right now. So you can see when I'm numbing these, some does go into the pocket, and this is already a pressurized pocket. It's already under great pressure. They're very, very firm. So you want to have that 11 blade ready to go, and right away. We do that. The 11 blade kind of incision to relieve that pressure as quick as we can. Okay, we're going to put some down here. It's going to be just a little poke, okay? 1, 2, 3, and you're good. There we go. Yeah, right when we get to the bottom, you feel a little, but that's flat. Quite a bit. So nice. Gotcha. There we go. So you'll see here, right there, all that clear fluid, that was some of the lidocaine that was right at the surface there. You can see it pushed out first. The second that went in. So I'm going to pause. I'm trying not to show too much blood here. So this one doesn't get restricted. So basically you can see with that one, let me just make myself smaller here because we're going to go on to the next one as well. There we go. It's going forward a little bit. We're going to go. So, yeah, the rest was just a little bit of blood there. And now you can see that bump is gone completely. And that goes down instantly, and then I will follow that and fill that pocket with just a Kenalog 4% or 5% usually. You did great. And we're going to put just a little Kenalog into that pocket, a little poke, and squirt that in. I cover it because I don't want it all to come out, so that will stay in that pocket there. And that's good. Now we're going to do this other one right here. Okay, here we go. A little poke right on the end. You did great. You can see the same thing. Just a smaller version of the first. Same thing that happened on the last one. There was a little bit of lidocaine first that came out. There we go. That lidocaine in the pocket helps a little, but the bottom's hard to get numb. There we go. So that one just wasn't good. So those flatten out pretty quickly. Still a little tender there. Sorry, but we'll put on that pressure bandage. And we're going to do just a little bit right into the base here. And a little bit comes out that hole, but that's why I cover it. Perfect. So that Kenalog will help that dry up. And this is actually our patient, our hidradenitis abscess of the chest, if you don't mind me saying, from over a year ago. And she had the huge abscess on the chest. And maybe we'll show a follow-up here in just a minute. After we get her all covered up, we can just look at that scar and see how well she healed. She's doing great. And we're going to get her on something a little bit more systemic here for a while to dry all these up. And that should, you can see that bumps down, and these are going to kind of congeal and push back in. And we're going to do that antibiotic with the Kenalog and with the drainage. Within days, these will look a lot better. So that's just a quick... So that was that one, and I'm going to have the next one coming up here in just a sec. Let me hit this and pause. Okay. So I'm going to make myself big again just for a sec. But so I have a lot of questions on my channel about, what would be the best treatment for her. What we put her on. Accutane would be a great treatment for her. She is one of my patients. It's a cash patient. She doesn't have insurance right now. She's a younger patient. And I know people in Europe, it's just how it is here in the United States. Some people in Europe or Canada don't understand but not everybody has insurance. And so they sometimes will come in just when they have an issue, and then I don't see them for a year or sometimes longer, and they'll just kind of sporadically come in, so we don't always have time for follow-ups, or especially with Accutane, it's very strict over here, 5 months, usually 4 to 5 months of treatment with multiple blood work labs that can be very expensive if you don't have insurance. But we do topical retinoids, and we can do intermittent oral antibiotics. The tetracycline group, with minocycline and doxycycline is a common one. That has kind of an anti-inflammatory component to it. If they don't have a sulfa allergy, Bactrim can work really well for nodular acne, for big nodules like that, and inflamed cysts too, as well. So we will utilize those for 2 to 4 weeks, sometimes even a month or two. Intermittently, I pulse dose it on and off if they're having flaring, and it does a pretty good job of bringing that back down. You want to be careful with long-term use of antibiotics with yeast infections. You can cause other issues of the GI tract if you're killing the gut flora with a long-term antibiotic. So, it's been, kind of crazy when people come in really bad all of a sudden. You haven't seen them in so long. Like, okay, let's kind of rework it and try to get you back on something. And that's what we do. Just kind of putting out fires, really. So yeah, the one that was supposed to cover everybody, you could exempt out of that because you were going to get a fine if you didn't do that Affordable Care Act. I think some people exempt it out. So that, we'll see what happens with that. But so this was her on the chest here when she came in with this large hidradenitis abscess, which you can see on the channel. It was, I'm in a different room. I'm downstairs now because Mrs. Pops is sleeping in the bedroom. So I can't do it from there. Um, but when she came in with that large, it was so painful that even taking breaths and expanding the chest wall was hurting her. And the ER wouldn't touch it. She had gone to the ER. She had a heck of a time with that. And I was like, I could feel the fluid pocket that was there. And I said, you know what? I'm just going to numb on the very bottom. And I'm just going to poke it just like at the bottom of a water bottle or a water balloon. And it just press it out. And it worked great for her. And it has not come back. And this has happened to her a couple times before I saw her. She said it would happen twice a year sometimes, but that was, it's been almost 2 years now, maybe a year and a half, year and 9 months. And this was her follow-up here. So let me just pull this back so you can see. This is an exclusive. I haven't showed this yet on the channel, on either channel. Right there. Okay, guys, this is my hidradenitis abscess patient, and you can almost see the outline here where that huge abscess was. It's just, it's almost like scar. But down here, she did have a little bit of scarring and a little bit of blackheads there, but those look great. And this is, gosh, we're probably a year and a half out now, and you can see just a little scar tissue from the chronic hidradenitis. But this is totally soft. There's nothing in there, no pain or anything like that. So I always like to do a follow-up just so, everybody likes to kind of follow the patients and how they're doing. We couldn't ask for a better outcome on this one because this was huge inflammation. So I'll tag the original procedure in the video. We'd just like to do a quick follow-up, and thanks to her for sharing. Okay, so that was just a quick follow-up. I always like to show those, sometimes, I'm busy, I have a lot of patients, and she actually has lost a lot of weight and looked great, and I almost didn't even recognize her, and I told her, I'm like, congratulations, you look great, good job on losing the weight, and that has helped her with her hidradenitis as well. But yeah, she looks so good. She's so happy, and I appreciate her sharing her procedures because they're great examples of high levels of inflammation and, purulence there that we were able to drain. So I will tag her first procedure in the description. It's an older video, but I think it's one of my top 5 or 8 videos of the whole channel. So it's got millions of views, I believe. But yeah, so that was good, and I just wanted to pop on and thank all you guys for the support and with merch and everything. It's been great. Things are going through, and I was very surprised. So sometimes you do that and you're not sure, hey, does anybody want a t-shirt or want a pop socket or anything like that? But it's been nice. So I appreciate that. And I have another, right after I get off here, I am posting an abscess on the back, and I'm going to call it the back tap abscess. I have it all saved and ready to go. I'm going to be posting that. And it's a patient you've seen before. He had the shoulder boulder abscess, and he's got scars on his back from surgeries that I didn't do. They're pretty big scars from cysts in the past. So he's had multiple cysts. And this was a cyst we were actually going to remove, and as a regular excision. And then in the time that I initially saw him, and when he booked to make the excision, he came in and it was swollen and leaking, and it had ruptured and become an abscess. So I'm going to post that video in the next half hour once I get off here. And I call it the back tap. I think that's what I called it. Kind of like if you're tapping a keg. It was like his skin is really thick on his back. And even when I put the 11 blade in, I was like, it didn't go right away. And then I go a little deeper and I hit the pocket, but his skin is so thick, it kind of closed it. It still held it in. So I had to put in a loop extractor because that's kind of blunt. I like to use those. And I kind of pry it open, kind of like tapping it, and it just gushes out. So that's coming here right after this. So look out for that on my regular Mr. Pops It. So that should be good. Let me see, Scotty, why do all the clients who see Dr. Pimp Popper claim that their regular doctors refuse to help them? Why wouldn't they refer them to a dermatologist? So that's a good question. And where we practice, because I'm only 35 minutes away from Dr. Pimple Popper's office, I actually get some of her patients that come over because they're so booked out. And where we practice over here, there's a lot of, the Inland Empire is a big area with a lot of people. And it is not a real wealthy area. There's a lot of HMO insurances, and a lot of those insurances deem certain things cosmetic or not covered by insurance. A lot of things that might not be elsewhere in other states in the United States. So you run into, you just kind of run into that where people are like, hey, they said there's nothing that can be done. So we see a lot of advanced lesions, like bigger cysts and bigger things. Advanced diagnoses. Sorry, this table's a little rocky. Because of that sometimes. And so people will come in. Now, when they're inflamed, a lot of times I can get them through the insurance, but I've run into that where they say, oh, there's nothing you can do. They don't cover it. The other thing is you have some people, if they're a little bit more poor in that area, they can't afford insurance and they don't have insurance. There is an HMO state run that is free, but not everybody knows about it or takes the time. So you have to sign up for it and do a lot of paperwork, and not everybody does it. So there are options out there, but a lot of times these younger people, they don't really even think about that until they have a giant abscess that's leaking or they're having an issue, and then like, oh yeah, maybe I should get insurance now. So yeah, so that is something that we do run into. I do have, and it's a video I did last year, and I'm going to get to it. It's going to be 3 or 4 videos. It is a inflammatory linear verrucal epidermal nevus. It's called ILVEN. And it comes from here, goes along the jawline and up the smile line here to the edge of the mouth of this man who is in his 50s, and it was a wide, long, chin strap like mole. And with those moles, they start to grow like a wart, basically. And when they start getting bumpy and hanging off, but they're benign. They are benign. And I cut this out for him all the way along the face. It was kind of a wider mole. Not a difficult surgery, but it isn't a sensitive area on the face, and it's a long surgery, just meaning it was a bigger area. And I did a running subcuticular, a really long running subcuticular, and it turned out great. And I have just seen his follow-up as well. He came back recently, and he literally, he was told that it had to be done by like a plastic surgeon. You had to pay cash for it, and it really affected him. And he told me this story. He was a Spanish-speaking patient. He didn't speak English. And he told the story about, how he got made fun of as a kid for it. And it was just really something that every time he looked in the mirror, it reminded him of kind of a tough childhood and a tough teenage years where people would make fun of him. And when he saw it removed and how well it did, he literally started crying. And it was just he said his family loves it. And it's just a thin line because I didn't put any stitches on the surface. So that's going to be a video that's coming. Probably not super soon, but I am going to post that one. I think it's a great story. And it was it turned out great too. And I didn't have to go super deep. I just went right down, just below the dermis there to the fat tissue. But it is a big surgery, and it is in a sensitive area. It's kind of a long video too, so I was just going to edit it a little more. But so that's coming as well. I thought that was a good one. So yeah, I'll do like 5 minutes if anybody has any particular questions about stuff that's up and coming. Just a reminder for the people that did order stickers and the pop sockets, they're going to come separate from like the clothing and the t-shirts in 2 separate orders because they're coming from 2 separate places. So just wanted to let everybody know that. Yeah, good question with chronic hives and allergies. Usually allergists and dermatologists work that up together. Everybody's different. Everybody has a different kind of level of allergies as well. And one thing that the allergist can do is they can sensitize you. They can sensitize you to things like, that you're really allergic to. It can take 3 to 5 years to do it, but they give you these little teeny tiny doses that go up incrementally over a long period of time. So a lot of times, I will utilize the allergists in that way. And then, I do the same things that they gave you, good antihistamines, topical anti-inflammatories or steroids, anti-itch creams for when it does happen. And I also ask people to take good notes if with hives. I call it a flare journal. And when it comes up, because hives will usually flare within, an hour to 24 hours of exposure. So if you keep breaking out over and over and over, you can have this flare journal. You write down everything that you ate and everywhere you went within 24 hours of when you get these breakouts. You might start to find your triggers. And it's usually multiple triggers, but that can be beneficial because some people are like, I don't know. I just keep breaking out. Sometimes it's just seasonal. Sometimes it's only in the springtime because that's when things are pollinating. But having somebody that is a really good detective as a provider can be very helpful in kind of getting to the bottom of what the triggers may be. Let's see. How does new skin get on the nose after all that stuff is burned off? Yeah, so you're talking about rhinophyma, I think, which is kind of this puffiness that happens with severe rosacea. And a lot of times it's just a thickening of that top layer. You get like this bulbous nose. And when you shave that, just like with anything, you're not going down to the fat. You're actually kind of just getting that thick, that puffy skin. And then once you take it off, it kind of heals. Now the underlying damage is still there, but absolutely it is strange when you see those rhinophyma patients. My wait list, Jenny L, is usually within a couple days I can get people in. I see a high volume of patients, which really opens up availability, which is nice. And I have a lot of help. I have a lot of medical assistance, so I can get emergencies and people in usually pretty quickly. And that's a good thing. I used to be booked out like 6 weeks, but if you hire more medical assistants, and we have a pretty spacious one of our offices and lots of rooms, we can really, when I look at something, I know what it is, I can explain to the patient, send out the stuff, and we can make them better pretty quickly. So I'm not booked out too far, which is nice, but I am busy each day. But I think some people are waking up upstairs. I'm going to have to, I think we're right at 30 minutes here almost. So, yes, find out what heat. That's a good, Byron Anderson. Heat is a cause of hives sometimes. So I do have patients that take hot showers because it feels good, and they got some hives because of being outside, and then it can make it flare even worse. So that heat is a big cause of hives. Now, some people wake up in the morning with hives, and it's because they have too many blankets, and their body temperature is actually, they're getting hot or sweating in their sleep, and they wake up with hives. Getting a thinner blanket can solve that. And I've had several patients with that issue. A lot of times, guys run hotter. It seems to be more women that have multiple blankets that have that, but it can happen to anybody. So, I'll end with this last question. What's good for reducing a large pimple? A lot of people will get a benzoyl peroxide. Yes, V-necks. I think I'm going to get some V-necks, Susan. Thank you. I wear a lot of V-necks. Why wouldn't I offer those, right? So reducing a large pimple, salicylic acid, glycolic acid preparations, or benzoyl peroxide, like gels, you can put them on, and they will actually dry up a pretty good nodule. And I don't really recommend people squeezing and poking at their own face unless they really know what they're doing. You can cause a permanent scar, or you can cut too much and cause a scar from that. What we use to drain is like a triangular 11 blade that is really sharp and very thin, so it heals right back together, and you do not get permanent scars from a lot of these extractions that we do. So yeah, some people do say toothpaste. I've heard that too, and that makes sense. That paste drying up would wick out moisture most likely, so it can happen. But I think we're at 30 minutes. I think the kids are one of the baby sleeping. I think she's getting up, so she's going to be running around here in a minute. But just want to thank you guys. Happy Sunday. I was in a new location today. It was a little bit different downstairs, but just thanks for the support, and we'll do this again. I'm going to try to do these on either Friday or Sundays. I've been doing a lot of work with the merch on Fridays and working most of the day on my day off to get this to happen. So I've been doing them on Sundays, but I missed one weekend, I think, too. So, but yeah, we'll keep this doing. Mr. Pops It Live just keeps slowly growing here, and in my regular channel, I got tons of videos coming, so it should be good. And I know I got to get some sleep. I am tired. I hope the dog doesn't wake us up tonight. So you guys have a great rest of your weekend wherever you are in the world. Thanks for popping by, and get ready. There's a video coming in just a couple minutes on my other channel. So you guys have a great day. Thanks again.